Welcome to part 5 of our session on yoga, mindfulness, and body-based interventions. This is the last section of our series. For this part, we're going to be looking at trauma-informed mindfulness. So as we begin, we'd like to start with one last exercise. Today, we're going to be doing a loving kindness meditation. So first, find a comfortable position to be in. It could be sitting or lying down. You might choose to put one hand on your heart or both hands above your heart for a soothing reminder and soothing touch. And then bring to mind another person or another being that makes you feel happy, content, someone that you enjoy being with. This could be a pet, an animal, or it could be another person in your life. And bring to mind the feeling of being with that other being. Create a vivid image of the being in your mind's eye. And notice spending time and sharing space with them. Then recognize how this being wishes to be happy and free from suffering, just like you and every other living being. Repeat these words silently to yourself, sending them out to the person or being that you are considering. May you be happy. May you be peaceful. May you be healthy. May you live with ease. Notice any warm feelings that might arise. And then as you're ready, add yourself to that circle of goodwill. Create an image of your mind of you and that other loved one together. And then visualizing both of you together, repeat, may you and I be happy. May you and I be peaceful. May you and I be healthy. May you and I live with ease. And then let go of the image of the other person, that other being, and let the full focus of your attention rest on yourself. Visualize your whole body, and then offer yourself the phrases, may I be happy. May I be peaceful. May I be healthy. And may I live with ease. And notice what it's like to send those messages to yourself. And if that might be different than the experience of sending those messages to your loved one. Take a few final breaths and let that sensation and awareness sink in. And then as you're ready, gently open your eyes if you've closed them. We'll come back to our presentation. So when we start to talk about mindfulness, it's always good to have some form of common definition. And there's many, many good definitions of mindfulness out there. One of my favorites is from a gentleman named Jon Kabat-Zinn, who is kind of the person who brought mindfulness to the United States. So he worked a lot with Buddhist monks and Buddhist philosophy and brought some of these ideas to the United States and spread them around quite widely. So in his definition, there's 4 parts. Mindfulness is awareness that comes through paying attention on purpose in the present moment and without judgment. So we have to have all four parts of that. We have to be paying attention in a very specific way. We should be doing that on purpose. When we're doing that mindfulness, that paying attention, we're going to be working on doing that in this present moment, this moment of what's happening. And we're also going to really focus on not having judgment about what's going on. Within this idea, in this definition, we have three main pieces, three main concepts or components of mindfulness. One is that intention, so choosing to be aware, choosing to allow that awareness to be present in your primary focus. And then using that awareness to bring attention to the present moment, to whatever's happening right now, this breath, this sensation, this thought. It could be any of those things that you're bringing your attention to, but we're doing it in this present moment. And then we're very cautiously, very intentionally having an attitude of openness, curiosity, being kind, and that last part of the definition, non-judgmental. So instead of thinking this thing is good or this thing is bad or whatever it might be, we're just having an open curiosity and we're taking away the judgment from that. There are lots of different concepts within mindfulness that become very important. The first couple we've kind of talked about, using attention and that present moment awareness. What's happening right now? Now it's happening in 5 minutes, or what happened in the past, but what's happening right now? Beginner's mind is another really nice idea where we're looking at doing everything as if it was the very first time we've done it. So the first time you go ice skating, you're really paying attention to how your feet are on the ice, you're paying attention to your balance, you're trying really hard to be aware of everything that's going on. We don't always do that the 100th time we try something. We kind of start to do things on autopilot without really thinking about it. So with the beginner's mind, we're trying to do everything as if it's the very first time that we have done this. We have non-judgment once again, but also non-striving. So we're not trying to do this, whatever it is, we're not doing this for a specific goal. We're not doing it to move forward. If we're breathing, we're not breathing for a specific intent or purpose. We're just being in the moment with our breath. If we're doing our yoga practice, we're not trying to necessarily get into the fanciest, strongest position ever. We're just doing a practice so that we can be in our body. We're going to pay attention to some patience, that even with this concept of mindfulness, things are not always going to come easily and quickly. So we need to have patience with ourselves and with people around us so that we can find that space where it's a little bit more peaceful. Part of that also comes along with letting be. So allowing everything to be present. It doesn't mean we need to specifically draw our attention to everything that's happening, but we're making space for the thoughts and feelings that exist, even if it's just for a short period of time. So even those difficult thoughts, those difficult feelings, we're going to create a little bit of space for them. We're going to talk a little bit later about how we're not going to create too much space because we want to keep this as a safe place to be. Over-identification is another thing that comes up. A lot of people will identify with their thoughts and their feelings as facts. And thoughts and feelings are simply thoughts and feelings. So I can feel one day or think one day that I am not a very smart person. And again, we're not judging this, but that thought or that feeling that I'm not a smart person doesn't necessarily make it true. So we're separating thoughts and feelings and saying, I'm feeling today like I'm not a smart person. I am thinking today that I'm not a smart person. That does not mean that I'm not a smart person. We're using mindful reactions and actions. So that again means that we're creating this space. We're slowing everything down so that we can actually choose how we want to react to something. So we're being very mindful about reactions and actions, whatever it is that we're doing. We're offering compassion to the people around us. So instead of maybe jumping to the conclusion that someone has done something intentionally to be harmful, maybe offering them compassion and saying, maybe they're having a really bad day. And then offering that same compassion to ourselves, which is often the hardest one, which is why we do the practices like the loving kindness practice we started with, where we need to give ourselves that same compassion that we offer to other people. And that for many, many people is much more difficult. I can offer my best friend lots of compassion or my family member, but when it comes to myself, it's harder to do. So we're going to focus on practicing that so that it becomes more natural. There are a couple of misconceptions that often come up when we talk about mindfulness. In mindfulness, we're not looking at that meditation or any form of anything where we just sit and have a blank, clear mind. So we're not trying to change things and clear things out in that manner. That's just a misconception about both mindfulness and meditation. What we're working on instead is training our attention so that we notice when our minds wander. We notice that, oh, I jumped to this thought. I jumped to my grocery list for tomorrow, whatever it might be, that we practice noticing when our minds go to that other place and then coming back to that present moment. And again, doing it without judgment. So observing and gently changing our attention is really what we're working on for mindfulness, not having a blank, clear mind or being in a perfect meditative, blissful state, but just being observant of what's happening right now. So sometimes this question comes up of mindfulness versus meditation. And I've actually heard this both ways, so I'm not necessarily saying that one is right or wrong. But in a lot of ways of thinking, mindfulness is one format of practice within a bigger family of meditation techniques. So it's a little bit different from other forms of meditation because it's looking to broaden our focus. So in meditation, we're often trying to only notice our breath, only notice the flame of the candle, whatever it might be. In mindfulness, we're trying to be more aware of other things at the same time. So maybe it's our breath, maybe it's our different parts of our body, maybe it's other parts of what's happening around us, but again, staying in that present moment. So mindfulness interventions often begin with those concentration practices, similar to our meditation, but they might grow to be a little bit wider so that we can encompass multiple things at the same time. So instead of moving to control our thoughts, restrict our thoughts, remove sensation, all of those different things, we're working to broaden, to pay attention to everything that's happening in the present moment. So you might ask, what are some of the benefits of mindfulness? And I also included meditation here because it's fairly similar. So there's a lot of different health and mental health benefits. So there's research that shows all of these things that you see on the slide, that it's going to help our blood pressure to go down. We're going to have better sleep, better digestion. We might be able to decrease depression and lower anxiety. We're lowering our heart rate along with our blood pressure. Because we're doing all these things, we're shrinking that amygdala, that fear center, when we're reversing the sympathetic fight or flight response, so that we're creating more space for the gray matter and to increase our emotional tolerance and flexibility, as well as our memory. So we're actually changing things in our brain structure as we're doing all of this, which I think is pretty cool. So specific mindful therapies. There are a category of things that are specifically therapy that you're going to only be doing if you're one of those trained mental health professionals. There's also a category of pieces of things that many of us do in our practice, even as yoga teachers. So we see that there's 4 current recognized therapeutic models that have a strong focus on our mindfulness practices. The one that came about the earliest is John Kabat-Zinn, who gave us our definition that we started with, and was really the person who brought and integrated Buddhist principles of mindfulness into the science of medicine back in the 70s. He founded a program called Mindfulness-Based Stress Reduction, which is a wonderful program. It's often about an 8-week program, a couple hours a week. It goes through lots of different components, many of the things that you see on the right side of the screen. Highly recommend that if you would like to explore that for yourself as well as possibly for your clients. In the 70s, we also had Marsha Linehan, who developed dialectical behavioral therapy, and that was combining some Western and Eastern influences. So that was specifically developed originally for people who had a personality disorder diagnosis. But one of the things that this incorporates is an entire module that gets repeated multiple times on mindfulness. So it moves through mindfulness, emotional regulation, some psychoeducation, and back around to mindfulness, and repeats that over and over again. Acceptance and commitment therapy was a little bit later, came about in the 80s by Hayes, Wilson, and Stroessel, and also had a lot of Eastern ideas. So we're looking at acceptance and commitment therapy, accepting what's happening in the present moment, this idea of radical acceptance, and then committing ourselves to being present with whatever that is. More recently, we have several folks who have worked together to build on Kabat-Zinn's work and develop mindfulness-based cognitive therapy. So that's another layer that you might be learning about or might actually be practicing if you are a mental health practitioner. So the ones on the left, that's going to be the things that you're going to be doing only if you are a master's level mental health therapist. However, all of the things on the right, all of us can do, and many of us who are yoga teachers do these things all the time. So we've talked about most of these already in some way, shape, or form. Mindful self-compassion, breathing, eye rest, which is a specific format of yoga nidra that was developed for military trauma. Yoga nidra can be used by anyone. Eye rest is, you have to do a little extra training for that one. Our meditation includes lots of different kinds of meditations. That could be a silent meditation, a guided meditation, a body scan, the loving kindness meditation, lots of things you could do. Sometimes we practice mindful eating, so taking that bite very slowly and paying attention to how it feels, how it tastes, how it smells. Again, just slowing things down so that there's space for the awareness of what is happening in that moment. Mindful movement and mindful walking could be any of these physical exercises that we're doing specifically to pay attention to our bodies, being very aware of the sensations of what's happening. It could be Tai Chi, it could be walking very slowly down the hall and observing what's happening. It could be our yoga practice. And then progressive muscle relaxation is another one. We practiced that a few sections ago in this series. I think most people are now familiar with that. So lots of different practices that you can do depending on your background and training, and some that anyone can do just for themselves. Mindfulness-based stress reduction has a couple of ideas that I thought were important to bring up. The most important thing is this idea that when we're starting to create space, we're allowing more of those sensations of physical and mental pain to possibly have space to come in. So emotions such as anger, fear, grief, other forms of pain can start to come up because now you're paying attention. You're not distracting yourself with everything else. Sometimes people wonder how much they should sit in that uncomfortable space. And really the answer is not much. We don't want to use this to sit and wallow in discomfort. What we might want to do is just barely touch it. Let there be a little bit of space to feel a little bit of that sadness, but not so much that we spiral into it. So we're inclining towards emotional discomfort just for a little bit, Over time, when we have more self-compassion, we might have more space and ability to get into that pain in a different way. But we don't want to go too far too fast. Part of that might be looking at these stages of acceptance. So you might start to turn towards that pain just a little tiny bit. And you might try to be curious about it instead of judging it. And just say, what is this? Where is this coming from? What is this related to? And then if you can, tolerate it just for a little bit. So you're going to endure only as much as you feel able to in that moment. You might allow some feelings to come and go. So again, not needing to stay in anyone's space, but allowing things to come into your senses and then do what you need to do with that. That might be saying, sadness, I see you. Thank you for reminding me of this thing. I'm now going to choose to move away from that and do something else. And then befriending. So we want to not have this attitude that we always have to be happy and smiling, that we see value in all of the different experiences that exist, including the difficult ones, and that actually makes our lives richer and better. As we go through these stages, we actually have over time, that gradual release of resistance towards experiencing that emotional discomfort. So the more we practice this, the more we're able to hold a little bit more of that pain, that sadness, whatever it is, in a safe and healthy way. And this is actually called titration. So this is one of my favorite phrases or ideas that comes out of a couple different modalities. But what we're doing is we're just touching that emotional pain. And then we're going back to a safe place. We're touching that feeling of sadness and then coming back to a place where we feel okay and reminding ourselves of good things. We're touching that memory of trauma, then we're going back to our safe place. So we're doing this so that we can develop better skills and self-compassion and help ourselves to grow instead of spiraling downhill. So in trauma especially, we want to first establish safety, stability, and self-compassion. With those things, we need to have awareness of, I am able to do this much right now, and that's all. And that's great. Do just that much right now, and then go back to the other things that keep you happy, stable, and safe. So we want to have this idea that we're being with something, but we're not going to be overwhelmed by it. We're not going to allow it to be too much. So when we're looking specifically at trauma-sensitive mindfulness, remember, sensitive comes when we're talking about the trained professional guiding people in something. We're really enhancing our present moment awareness, our self-compassion, and adding in that ability to self-regulate. Sometimes mindfulness can also increase one's capacity to integrate trauma and regain that sense of agency. So we've talked before about wanting to have control over what we can. We haven't had control over things that have happened in the past, especially in trauma, but we can have control over what's happening in this moment. How much do you want to explore this or not? What sometimes happens when we work with people who've experienced trauma is without meaning to, we're inviting them to come into contact with some of those traumatic memories, those sensations, those images, those thoughts. And without intending to, that could lead to some of that dissociation or other negative re-experiencing situations. So what we want to do is do this very intentionally and slowly so that we're not intensifying trauma symptoms. We're not re-traumatizing people. Instead, we are doing things very intentionally to allow just that little bit of emotional control or self-regulation or self-compassion to come in. So when we're looking at this, there's 4 ideas that might become important. Realizing that there is an impact of trauma. If we're going to be trauma sensitive, we have to know that trauma has impacted people. We need to be able to recognize those symptoms and then respond to them in a very specific, skillful way so that we can prevent re-traumatizing people. And that's going to be using all of your clinical skills that we do in every other format in therapy. We're really going to focus in that trauma-sensitive mindfulness on the present moment. So we're doing that through dual awareness. So what happens when you're in a trauma memory, because remember, it's again saved in a different part of your brain, is sometimes people feel like when they're having that memory, they can't tell if it's happening in the present or the past. So it feels like it's happening right now. So what we're working to do with the present moment is establish the awareness, the sensations that we are in this present moment. We have that distance from the past. That trauma memory is not happening right now. Right now, I can feel myself breathing. I can feel my feet on the floor. And at the same time, I can maybe remember that trauma. So allowing ourselves to stay in that moment, even if it's a little bit uncomfortable, it's a little tiny bit of exposure therapy. So we're trying again to do that titration. We're going back and forth. Here's this thing that reminds me of my trauma, but I'm going to work really hard to stay in this present moment and be aware that the trauma is in the past and it's not happening right now. So this is what we're working with if we're using mindfulness specifically as a trauma treatment tool. So how do we actually do that? Lots and lots of different options here. The first one is to offer lots of choices. Like we said, power has been taken away. We're trying to give power back. We're giving them as many different choices as we can, and they can be super simple things. So whenever I lead guided meditations, or even just a grounding exercise, I often say, either turn your gaze down towards the floor or close your eyes, whatever's more comfortable for you. We're putting options in place. Incorporating a little bit of movement might be helpful. So sometimes when we're doing breath work, just breathing feels triggering. So we're going to breathe with our hands coming up. Exhale with our hands coming down. Inhale up. Exhale down. Could also be arms out to the side, overhead, whatever it is, does not matter. Perhaps we're not going to have people lie down for a meditation. Maybe they're going to stand up or stay in a seat or even a chair. Again, I said maybe we're keeping our eyes open. That helps us be triggered in a positive way to be aware of this moment, what's going on in this environment. We might modify our breath. We might use that soothing touch, a hand on the heart. We might have a focus on external objects. Some people love to do meditations looking at a candle flame, so they have something to focus on. We could do a 5 senses exercise, noticing what you can see, hear, taste, touch, smell. You might focus on other sensations. How do your feet feel if you're walking? If there's touch being used, and this is not a part of the trauma practice I do, but I know there's some people who do, always respect those physical boundaries, ask for permission, and make sure they're comfortable with whatever touch is going to be happening and aware that it's going to be happening. And we might have shorter practices. We're going to make sure that we have that safe space, just like we talked about in our yoga series last time. So those are a lot of ways that we can alter our typical mindfulness or meditation practices that might make things a little bit safer for our clients or our students, whether it's in our therapy office or in our yoga studio. A lot of these things are done by yoga teachers often. And if you can incorporate some of these ideas into that, you can make it a little bit safer for the people in the room that may have experienced trauma or have some other kind of mental health diagnosis taking place. So once again, I'd like to thank you for taking part in this series, for watching all of this. I hope you've gotten something out of it. And if you have any questions, I hope that you reach out to me and let me know what those thoughts or questions are. I would love to talk with you further. For now, thank you so much and enjoy the rest of whatever you're doing today. Thank you.